Welcome to our interview today. I'm Joel White, president of the Council for Affordable Health Coverage, an advocacy coalition in Washington, D.C. that's fighting for lower costs for all consumers. Today, we're joined by Mark Squires. He is the Medicare whisperer and has been involved in whispering about Medicare and reporting on business news in the Medicare markets for over 23 years and is in the Kansas City area. Mark, welcome to the interview today.
Thank you. It's good to be here.
Absolutely. So today we want to talk a little bit about the Medicare market and what's happening as seniors are in the middle of open enrollment period. They're signing up for plans, they're shopping. I think at a macro level, what we see is premiums are way up. We've got 23% on average increase in the Part D market. We see costs up, doubling on the average Medicare Advantage deductible. We see a lot fewer plans this year and higher cost sharing maybe on some of those plans. What are you seeing in the Kansas City market? Are people shopping? What are they seeing? How are they reacting?
We're seeing the exact same thing here. Of course, Blue Kansas City dropped out of the Medicare Advantage market. Aetna dropped one of their largest Medicare Advantage membership plan. They've closed it down in the Kansas City market. We are definitely seeing probably the most stark change I've seen is the Medicare Advantage plans now are featuring medical and prescription deductibles. And in the Kansas City market, that's been very unusual. You hardly ever see a medical or a prescription deductible on a Medicare Advantage plan here. This year, almost across the board, almost every plan has put one or the other or both in. What we're really seeing is the shocker is our phones are still ringing. We started scheduling appointments in June for our existing clients for reviews, and we are by referral only. Nobody's ever going to put this face on a billboard, and you're welcome. We're seeing this. The phone's ringing every single day, and our calendar is getting fuller and fuller and fuller. One of the major Medicare Advantage companies canceled their contract with Prime Health. That's 3 major hospitals in Kansas City. About 2,100 of their patients were on with this particular Medicare Advantage company, and they're out looking for new coverage today. A lot of turmoil, and that's the best word I can use to describe what's happening in the world of Medicare right now is turmoil.
So when you get these calls from seniors, are they confused? Are they angry? Are they what's the general mood for those calls?
The number one comment we hear from our clients across the board is, why are they doing this to us? And, we try our best to explain the Inflation Reduction Act and Congress and how these things really work. We have a little one-pager we send home that has all of the nationally elected servants for the Kansas City area. Tell them if you really want to, file a complaint, call and talk to a legislative assistant or a chief of staff at this congressperson's office or this senator's office and make your voice heard. Confusion is, of course, that goes with Medicare. It's just part of Medicare is confusion. Even though I say on a regular basis, nothing with 3 moving parts is really that confusing. It's just trying to figure out where a human being fits into those 3 moving parts in a world where one size fits all doesn't work.
Yeah. So in terms of what else they can do, obviously they're calling you. You suggest they go to Medicare.gov. What are some of the options that people have to maybe avoid some of these premium increases or cost increases? What do you tell them to do?
Well, clearly we prefer it if they work with us, but we do let them know about Medicare.gov and 1-800-Medicare. And as I tell people all the time, 1-800-Medicare is available 24/7. And if you call them on Sunday morning, they're about as lonely as the customs agent at Kansas City International Airport. So they don't have the call quotas on the weekends or later at night. So you have a little bit better experience. We can send them to SHIP, the state health insurance program, to one of their claim volunteers. If that's what they want to do. We're always, our number one goal is to do what's best for the client. And one of the things I almost preach religiously to my entire staff is we're all going to be on that side of it one day. And as much as we think we know about it, it will change by the time we get there. So let's treat people the way they're supposed to be treated. If they want to work with us, great. Let's teach them about Medicare.
So I'm curious, one last question here. When folks find out that a lot of these changes in the marketplace are really being caused by the law that Congress passed in 2022. Are they, are they upset about that?
They are very upset about it. And it's kind of a dichotomy is those folks who are taking just the basic run of the mill, maybe a blood pressure, maybe a cholesterol medication and not much else. They're the ones that get a little more upset. The ones who are taking major brand name drugs, we don't want to name any here, but if you're seeing TV commercials for them, they're expensive. Those people who are going to hit that $2,000 out-of-pocket maximum, once they understand how to work for them, they're pretty happy about it, but they still don't like change. And when we explain to them the offset of underwriting and risk and how they're transferring risk from one side to the other and why premiums are going up, why deductibles are going up, why their drug, who's been on it's been on a tier 2 forever, is suddenly on a tier 3 and is going to be a 40% cost share as opposed to a flat $10 copay. They get pretty upset about it. It's confusing enough. They have enough to do in their lives without worrying about this. Our hope is that 100% of the people on Medicare will do a review this year. We know the reality is they won't, but we're seeing a trend of about 70 to 75% will do a review this year.
Yeah, and when those people with maybe one or two drugs, blood pressure medicines, you see a lot of them, their drug is moving up the tiers on the formulary or maybe not even being covered.
Both, more so moving up tiers, but we have seen a few, generic drugs. There's one Tussin Pearls. You and I probably took it when we were children for a croupy cough, as my mom used to say. It's not on any formulary. Venlafaxine in Kansas City, it is not on well, the venlafaxine in the capsule form is not on any formulary. The tablet is, or maybe vice versa. So we are seeing common drugs that are just off formulary now. And I've taught for years. I've got a couple of videos out on the YouTube channel where I say, at this point, we have to be a savvy healthcare shopper. We'll look at the coupons and we know if we go to the hardware store on Wednesday as a senior, we get 10% off our light bulbs, and we'll do that. But when it comes to healthcare, where we know we're going to spend in retirement well over $100,000, according to Fidelity Investments, we need to be a savvy healthcare shopper, and that comes down to how you handle your Medicare and how you build it. One of the beautiful things that's happening right now, Joel, if we've got a minute, here in Kansas City, is with Blue Cross Blue Shield Medicare Advantage leaving the market and with Aetna SmartFit leaving the market, the rules state that those people have pretty much the world as their oyster. They can move to a Medicare Advantage plan, depending on their date of birth, which one, I'm sorry, Medicare supplement, but depending on their date of birth, which one they would have access to. But we've had several clients that have been on Medicare Advantage for years and years that have some pretty serious health issues that are opting to move to a Medicare supplement. And I am on record, and I've stated many, many times in my career that if a person can afford the premium for a Medicare supplement, they're going to have better overall healthcare outcomes.
An important point, and just to wrap things up here, just so folks know, the law that was passed in 2022, the Inflation Reduction Act, radically changed this benefit. It's creating these premium increases, deductible increases, some of the changes in access to drugs that Mark talked about. And I think the wise advice you provided was, if you don't like what you're seeing, get in touch with your member of Congress. They changed the rules, which is producing these changes, and they can change the rules again to correct for the intended or unintended consequences. So Mark, want to thank you for being here today. Mark Squires with the Medicare Whisperer. Always a pleasure.
Thank you so much. Have a good day. Bye.
Thanks.